All right, so I'm going to talk about loop diuretics. So with the loop diuretics, the prototype is furosemide, brand name Lasix. The pharmacokinetics, it's available orally or IV. So let's go oral. So oral, it starts working in 30 to 60 minutes. Peaks in 1 to 2 hours. IV works in 5 minutes. Peaks in 30 minutes. Orally, it lasts 6 to 8 hours. IV lasts about 2 hours. The action it inhibits sodium and chloride reabsorption. In the loop of Henle. Sodium losing effect is 10 times greater than thiazides. Use. The book says to treat hypertension, but we're not going to treat hypertension with this drug. So acute pulmonary edema, heart failure, hepatic and renal disease. Other drugs within this class would be bumetanide or bumetanide or Bumex. Ethacrynic acid or edacrin. And then we have torsemide is Demodex. We're not going to talk about children right now, but should not be given greater than 6 milligrams per kilo of body weight per day. In older adults, they should start low and increase as needed. If patients have renal impairment, renal dysfunction may increase and drugs should be stopped. In patients with hepatic impairment,
they were disappointed in the ending because it was 8 years of people's lives watching the show, and the problem was older, they were running out. It was just that they had to wrap it up, and they're like, "Look, we don't have." I don't think they were signed for a ninth season.
electrolyte imbalances
It came down to
that may occur on these drugs can worsen
Schitt's Creek is supposed to be
hepatic
what about Ozark?
encephalopathy.
Yeah, Ozark. I don't know all about it. I just know there was another kind. I haven't watched it.
Adverse effects.
I just know a lot of people, my friends and stuff, watched it and said it was really good.
Fluid and electrolyte imbalance.
No, Sneaky Pete.
Contraindications
The Expanse and Sneaky Pete.
would be known sensitivity, or anuria, so the inability to urinate. And then patients that are allergic to sulfa drugs may
If you like
be allergic to furosemide.
assuming you've seen Red Tails.
Furosemide
And have you seen Flight of the Phoenix?
allergy.
Did you ever see Flight of the Phoenix?
Nursing implications.
That's a good one. We're gonna watch Flight of the Phoenix.
Would be watching out for drugs and herbs that affect furosemide. So, like digoxin increases the effect of furosemide. Corticosteroids increase the effect of furosemide, ibuprofen, decreases the effect of furosemide. Phenytoin decreases the effect of furosemide. And then we have herbs. Hawthorn, mistletoe, periwinkle all increase the effect. Ginger, cola, licorice decrease the effect. So administration. IV should be given over 1 to 2 minutes when pushed. And then continuous infusions. IV should be given 4 milligrams per minute or less. For continuous infusion, should be mixed with normal saline or 5% dextrose. Oh, I'm sorry, I lied. Or lactated ringers. Never mix with 5% dextrose. Assessing for therapeutic effects would be decreased edema, increased urine output, book says decreased blood pressure, but since we don't give it for hypertension, we will not look at that. Assessing for adverse effects, electrolyte imbalance,
Oh, you gotta watch that movie, dude.
fluid depletion.
So it's an airplane movie, but it's also true. I guess in the 70s or 80s, Pablo Escobar was big with his coke runs.
Obviously, with the electrolyte imbalance, we're looking at hypokalemia, teaching, limit sodium intake.
There's still millions of
So don't add salt to food would be the easiest way to teach them. Reading food labels.
You know, it's not a classic.
Increase potassium in diet.
Yeah, he's a pilot.
And
He's bored.
we would want to give them hypotension symptoms